Thanks for putting together a bio for us, Dr. Saad. We have a special guest on screen today. I've known him for a number of years myself, not as long as Bill, but I've got to know him through different occasions, different conferences, and yes, he is a very good speaker, and he's got very interesting things to say. Dr. Jasim received his Bachelor of Science from Baghdad University in Iraq, and his PhD and Masters of Science from University of Wales, Swansea. Maybe he can elaborate on what university it is in the UK. He's the president of SJ Environmental Consultants in Windsor, WASH Ambassador District 6400, Rotary International, member of the Climate Crisis Task Force, Ontario Society of Professional Engineers, Editor-in-Chief of Ozone News, International Ozone Association, adjunct professor at University of Windsor, teaching a graduate course in Masters of Water Treatment and Reuse. He is the recipient of 2025-26 Consumer Choice Award Business Excellence category, Environmental Consultant. So as you can see, he's got a beautiful resume. He's a recipient of 2022 Ontario Professional Engineers Award, Medal for Entrepreneurship, the recipient of 2004 Engineer of the Year Award at Professional Engineers of all of Ontario, first Canadian to serve as president of the International Ozone Association 2020 and 22, introduced ozone as primary disinfectant for drinking water in Windsor. That was the first in Ontario in 2021. Solved the arsenic and manganese problem of drinking water in White Rock, BC, where I think he was stationed for quite a while in 2019. Served as a director of Great Lakes Regional Office International Joint Commission, the IJC, for Canada and US from 2010 to 2013. Founding CEO of Walkerton Cleanup Water Center, when we know that had a great big problem, the tragedy in Walkerton. Designed and successfully implemented ozone application for water reuse for greenhouse operation in Leamington, and supervised the PhD and master's students at 3 different Canadian universities, and presented many papers on water treatment. Let's welcome our fellow Rotarian, but from 1918, Dr. Saad Jasim. Take it away.
Good morning. Well, thank you for the invitation. I visited the St. Clair Rotary before, and it's great to be back. And I'm going to start with the presentation. Can you see it now?
Set up before. There it is.
Okay. The title of the presentation is Water, Sanitation, and Hygiene. And this is, in fact, try to explain the role of this group, the Wasrag for the Rotary International, which is started in 2007. And it has a group of Rotarians, Rotaract, and professionals in the water and deal with issues related to the sustainability of water systems and solve problems related to water, sanitation, and hygiene. And March is, as we know, the Water and Sanitation Hygiene Month for the Rotary. And as you see this list, promoting peace, fighting disease, and we focus also on the providing clean water, sanitation, hygiene. This was main focus for this group. But also we involved in many other things like the improving maternal and child health, supporting education, growing local economies, and protecting the environment. And the United Nations has established 17 goals. And the goal number 6 is to ensure availability and sustainable management of water and sanitation for all. And you could see here, this circle here shows The dark color ones is directly connected to water, which is like life below water, life on land, um, climate action, sustainable cities. So quite important things, good health and well-being. Safe drinking water is an important. And you have safe drinking water, you have a better sanitation and better hygiene. And that's why we've been pushing for the issues people to implement things. Do not wait until the problem happens, like what happened in Walkerton. Key objectives, sustainable impact, and also share technical expertise and global membership. The Wasrag has, representatives or ambassadors from different parts of the world. And we meet every month in the morning on Tuesday, 10 a.m. on a virtual meeting to discuss any updates. And we have on WhatsApp a group things, and we share the activities and what we do. And it's good to share because sometimes we have some seminars that people can get involved. And there is also potential funding for these things for global grants up to $2,000 for approved projects to improve viability. Education is an important. That's why seminars is important. Not many people realize how the issue of water and sanitation and hygiene is important. We went through the COVID-19 and we were talking about it. Clean hands and clean water is important. And what you see here, there are many challenges the world is facing. There is about billions of people, 2.2 billions, lack safe managed drinking water. And about 3.5 billion people lack safely managed sanitation. And 2.2 billion lack basic hand washing facilities. You see these things, we look at it as because we have it here, we don't look serious at it, but when you have a problem, and I think, the knowledge we've been getting from visitations to other locations like in Ghana, Guatemala, and other locations, people start to realize how important this issue is. And the goal in 2030 to reach that, unfortunately, sometimes does not look because it's only 4 years left. And with the climate change and with the potential political issues, sometimes we think we might not reach that. Water is life. Clean water means health. And I remember when the Walkerton situation happened, I could not believe it watching on TV. Helicopters start carrying people from Walkerton to different hospitals because the hospital in Walkerton was full. They went to London and Toronto and other places. And it was an eye-opening because we believe, Canada is a member of the G7. We should not have these things, but we should never say it will never happen here. It happened in the US in 93. Everybody knows Milwaukee. Did you know that there was an outbreak in Milwaukee in 1993? 100 people died and about 400,000 people were impacted, were sick, and many thousands hospitalized because of parasite in water. So we should be extra careful when we deal with these issues. Access to water and sanitation is important because it is a human right. And that's what the United Nations are breaching on this. I know some people don't like United Nations or something like that. Yeah, it has weaknesses. But to be honest with you, I look at it from the issue of health and water issues. They are doing a great job. And it is the strength of the United Nations is from the support receives from members. And if we look at the issues of waterborne disease and transmission, it's a triangle: humans and environment and the causative agent, which is the bacteria or parasite. And it is all connected because humans contribute to that. How is this? Because when a human being goes to the washroom, goes to the sewage treatment plant, and discharge goes where? To the river. However, if the treatment is not as good, that means more bacteria and parasites going there. And that's what happened in Milwaukee. And there is always a balance needed between all these the environment, health, and causative agent, because the impact is especially on people with low immunity, infants, elderly people, individuals who have some immune disorder, especially if you have dialysis, something like that. People have major problems if this get impacted. In Walkerton, we had a population of 4,800 only, and 7 people died, and more than 2,000 were sick. And this is not a good figure because almost half of the population. What we see here, these are the things that we worry about and the pathogens, viruses, bacteria, and parasites. And the sizes gets much smaller when viruses, bacteria slightly bigger, parasites are bigger. But even that, when you say it's bigger, this is, could be as small as 2 microns only. And this is the cryptosporidium, between 2 to 5 microns, where the Giardia is up to 10 microns. So we have to keep in mind, the water may look clean, but we have to make sure how it was treated. Like before I travel, I look at the website to see how they treat the water in these cities. Believe it or not, there are some big cities, they don't have filtration system. Like in New York. New York they used to do only chlorine until water is taken from like a lake reservoir and chlorinated, send it to the city of New York. Only about 10 or 12 years ago, they added UV. Still not enough, because even this is a breach of Safe Drinking Water Act in the US, because it shows that surface water must be filtered. And same thing with the city of Boston. The EPA took the city of Boston to court, and they lost. Politics override in science many times, unfortunately. These pathogens, they have the main impact and symptoms, that is nausea, vomiting, diarrhea, fever. And there are some special impacts on certain ones, like the one in Walkerton, that is a certain strain of E. coli cause kidney failure, and that might cause bleeding. And so these things, each one has its own way. What we see here is a cycle, how we might be impacted by that and how we can get it. And that's why people have to be careful. Even sometimes, like going to swim in a river is not a healthy thing at all. Doesn't matter, it's a clean lake, they say, or because animals could go there, sewage treatment plant discharge there. Like we are lucky in Canada and United States to have the Great Lakes. It's 20% of the world's fresh water. But do you know how much discharge into this from sewage? There is 1,448 sewage treatment plant discharged into the Great Lakes. That does not include tens of thousands of septic tanks that they are most probably they leak, and they leach into the lake. So we have to be very careful. One of the new challenges we have is the antibiotic resistant, and what they call the microbial antimicrobial, and the World Health Organization's collected data from 114 countries. And they said this is the post-antibiotic era, because the reason is when we take these medications 25% of that gets into the body, and most of the rest goes out in the human waste. Where does that go? To sewage treatment plants. Sewage treatment plants are not equipped to remove these pharmaceuticals, and they could be endocrine disruptors. And unfortunately, as I said, the politics sometimes override things. Years ago, I've been involved that, and I still involved in these issues. I had a call from the communication from the Globe and Mail, and they asked me, have we solved the pharmaceuticals and endocrine disruptors issue? I said, no. So they said, why nobody talk about it? Well, I said, the problem is media and politicians, they pick always something and they forget about the others. Pharmaceuticals, we started doing these tests back in the year 2002 in Windsor. And I remember people, they said, why you do that? Well, I said, we need to know, is our system capable of removing that or not? And then years later, the plastic came. And I said to, when people one time asked me in a conference, I said, we do tests for some of the components of plastics. The bisphenol A, which is now Health Canada recommend not to use plastic bottles for for baby milk, bottles. So it has to be glass, because with warm milk, it will leach. The same thing with water. That's why plastic bottles of water, if it stays in the sun or in a warm area, that plastic would leach. So the treatment process need to look into that. What you see on this slide, and like we were able to get with simple antibiotics, get rid of urinary tract infection, but now, as you see, halfway maybe or less. So that's why we need to look at seriously how to improve our treatment systems to reduce that. And also, do not throw any antibiotics or any medication into the sewage and all that. But to be honest with you, I don't think this is as big as what comes from human bodies. Disinfection is one of the key treatment processes, and it is an effective barrier. We always say we need to have a multi-barrier system, because if something is not working properly, the other barriers will do. But disinfection is a key, and you have to select the proper disinfectant based on what challenges you're having. Challenges in healthcare and community, and we've seen that clearly during the COVID. And the lack of knowledge, unfortunately, with some of the people who are making decisions. Like we try to get sanitation systems for hospitals, schools, and unfortunately, Health Canada took 3 years to review it. And they didn't reach a point. Every time they came up with something. And the company was supposed to bring a unit to disinfect things in hospitals and all that. And and the company is in the UK, and the item they do is certified by the EU. The company walked away because it cost them too much money, lawyers and all that. They said it's not worth it. They are selling these units in the UK, and Germany, and many others in the European Union. But the thing is, we were asked some silly questions by Health Canada, and the team on that. In fact, the only people who made money in this were the lawyers, unfortunately. Well, that is unfortunate, yeah, because almost $100,000 the lawyer collected in 3 years, and the company could not sell a unit. So they walked away. They said, we never seen anything like that. And in communities, poor hygiene. That's why during the COVID, we said the advice is to wash your hand for 20 seconds, warm water if possible, with soap, reduce that. That could be anything with touching animals, inconsistent use of safe sex, a few vaccines could prevent the disinfection. Even we've seen some people advocate against vaccination, all that. But the thing is, if you take the vaccines, I personally take the flu vaccine, I took the COVID vaccines, because especially if you travel, you meet with people, if you have the vaccine, the impact of these pathogens would be lower if it's not prevented 100%. So at least, and it shows like the push we did here in Canada was, I think it was reasonably good. It reduced potential problems like in what happened in other countries. So many groups have been working on the issue of water and sanitation. The Windsor 1918, they did great work. Dr. Godfrey Bachia, as everybody know, he started that, and now with Ronald Arkell as well, they've been leading these projects and been going frequently to Ghana to help. And I was talking to Ron Arkell, and he shared with me some of the photos they did here and some of the projects. It's about 25 years they've been working on this, and they provided schools and school furniture and all that, because education is an important part of understanding the sanitation and the hygiene issue. And so they start to teach people. And if you remember, and I'll mention that in later slide about the issue of bringing water, that's the gender and water issue. That was the World Water Day this year. And the having one of the Centennial Legacies project, $110,000 water projects were completed for town of Jarapa, and they were getting about 200,000 gallons of fresh water a day. And that's important. One of the important things is also teach people how to resolve problems if some technical things happening, because you don't want to have the system idle because something small problem happens. And they work with rural villages, they teach people, and the people, they welcome them because they know those people coming, volunteers to help and support the systems there. And you see here, these are a couple of the projects they've been working on, providing sanitation locations, hand washes, and all these things. And this is some of the projects that have been completed and different groups. This one by Maidstone, Ontario. So it's great to have these projects happening. Many clubs are involved, and everybody is welcome to get involved. The United Nations recognized World Water Day on March 22nd every year, and every year there's a new theme. And the Rotary International recognized that, and the Wash Rag group support that. And this year was water and gender, because the involvement of, especially in Africa and in other places, women bring the water and walk miles. But the problem is they bring water from lakes or rivers, and it is contaminated. So it's good to have a proper, healthy, and safe water on location. So you save these ladies from having danger in walking miles and exhaustion, and having safe water on site. So wisdom is knowing the right thing to do. Integrity is doing it. And that is our theme, the WASH Rotary Action Group. Join the WASH Rotary Action Group and make a difference. Thank you. And if anybody have any questions.
I've got one, Dr. Saad.
Yes.
The Northern Canada, is it still an issue I'm going to say reserve. I don't know what proper name that where the
well, the Aboriginal
are,
communities,
like, the Aboriginal places that are
there. Which is the First Nations, Inuit, and Métis. Yes, they still have problems. There are major number of First Nations and Aboriginal under communities under boiled advisories.
Is there something
that is
being worked
unfortunately is not solved.
Is there something being worked in the government? Is there lobbying?
There are programs. Yeah, there are programs, and it's still going a little bit slow because of too much of how can I say, logistics and this and that, and the locations is part of the problem as well. Like I did the training to First Nations when I was with the Walkerton Clean Water Center, and I was the CEO of that center. Like I was the founding of that center, and they were surprised that a CEO will come to them. Because no, they said nobody, no officials come to visit us. I was in James Bay, and as you know, James Bay is a bit far. I stayed with them 3 days there, ate with them, sat with them on the ground, talked to them, and because for a small system, the water operation could be abandoned because of failure of something. Unfortunately, some consultants, I'm not saying all of them, no, some consultants, they build the system without teaching the people how to operate properly or to solve problems. So they milk these groups, you know. That's why the funding you build a system and you keep paying money to fix things. They don't teach people how to solve problems. Troubleshooting is important. And that's why it's always needed. And education is important as well.
Question number 2.
Yeah. Thanks,
Okay.
Saad. This is a little bit peripheral, but Stuart mentioned AI earlier today. And what I've heard is there's a great concern about the use of water by AI. Do you have concerns about that? And if so, what are they?
Well, we have to have more rules for applications of AI. I've seen it in different issues. Like one time I was watching a video about AI, and they were saying, oh, if you want to write an essay, you put 2-3 lines and it will fill a page for you. That's wrong. And the same thing for processes. Yeah, it could help, but it has to be under control. AI will not replace a human approach because we think different than machines. We made these machines working, so we must be better than that.
That's a good response. But actually, my question relates to the fact the use of water for AI. Apparently, AI requires a lot of water for cooling. And what I've heard is they're going to use closed systems, but that really isn't trusted. Do you have a concern for a lot of water
Well,
use?
you need a lot of data to reach the proper solution. So the AI will provide as a proposed solution, but the consultant or the engineer has to review it carefully. You can't depend 100%. Because if tell you, okay, you need to do that, for example, you mentioned the cooling water. Well, cooling towers, we dealt with this situation. Cooling towers is getting corrosion. Why? Because the kind of water is used. So what do you use? You need to do something specific. Yeah, basically, AI will collect whatever available data. But as always with water, it's a site specific.
Thanks, Saad.
Thank you.
Dr. Saad, probably about, I'll say 35, 40 years ago, I was reading a periodical in a fire journal. And at that time, they were looking at causes of death. And usually at the top of the list was slip and fall. And then after that, these are preventable things, not medical things. But then they look at, car crashes and train crashes and everything else. And the list kept going down as far as frequency of death. And you finally got down to what number 75 on the list, and that was death due to the exposure to asbestos, which I thought was interesting because it's way down the list. But I looked, and I forget whether it was right above it or right below it, was death caused from drinking the water in New York City. And it hit me at that point that, we have a lot of domestic problems, and I keep, you mentioned New York in there with their problems, but what about Flint, Michigan? Are they solving their problems as well?
Well, Flint, the situation in Flint, and that's what I said, this is site specific. They changed the source of water without doing the proper study on the impact of the water quality on potential oil pipes, a problem. So that's why you need to do a pilot study, a bench scale study before making change in the operation or change of the source water. And that's why they changed the source water without looking carefully into the issue of the pH, alkalinity, and all that. And that's what caused the problem. And this situation it shows like that's why we say there is no silver bullet to solve problems everywhere. So you have to be very careful to deal with that. And what we use, and you're going to see next month, there will be an announcement about the 25th anniversary for application of ozone in Windsor. We applied it in June 15th, exactly 2001, the first city in Ontario. And we brought people from other cities to train. And I went around and tried to talk about it. And so that's why about 7 cities or more applied the use of ozone now, like Burlington, Oakville, Toronto, and few others. And ozone in water is important because it's very strong compared to many other disinfectants like chlorine. It reduces the use of chemicals. It can oxidize and remove degrade these pharmaceuticals. So all these things you need to consider. What do you need for water depends what is the problem in your source.
Thank you, Dr. Saad. Unfortunately, we're a little bit over time, but I want you to let us know one more thing before I give you the official thank you. We know that Wasrag, RAG, the RAG part is Rotary Action Group. What does the WASH part mean?
WASH is water, sanitation, and hygiene.
Water, sanitation, and hygiene, and the A is
Yeah,
there.
and that's what I used in the title.
Okay.
Yeah.
I thought it was something simple, but I just wanted you to let us know. Okay, thank you for being here. We appreciate you. We wanted to try to get you in March, but we had a few other guests involved. So I'm glad you're here to explain a lot of things because we do kind of know that, and we hope to get the word out. So somehow, and I don't know how we're going to do this, but somehow you and I can get together and we can give you this honey as a thank you. It's locally sourced, and this is really good with purification of impurities.
Okay, thank you.
So with that, thank you.
Thank you.